Hi there, I'm Lucy McDonald, physiotherapist. Welcome back to my virtual clinic. Today, I'm really excited to introduce you to my guest, Olivia. We're going to be talking about how she recovered from not being able to do very much as a result of her hip arthritis to doing all sorts of exciting activities, which she will explain in a minute. So, Olivia, welcome to my virtual clinic. Thank you very much for joining us today. It's probably best to start with when we first met. What were your symptoms and how were they affecting your life?
So we first met just after the start of first lockdown, when I had increased the amount of exercise I was doing with my dogs, and I gradually found that I actually almost got to the point where I could hardly walk. Such was the pain that I was in and my distress, because I've always been so active and physically busy in a whole host of different ways, that I tried to get an appointment with my GP, but because of lockdown, I was told that it wasn't urgent and they couldn't possibly see me. So because I've always had a sporty background, I was prompted to go and see a sports scientist specialist, a doctor in sports medicine, who examined me and did an x-ray, and she confirmed for me that I'd actually got arthritis in my right hip and in fact in my knee, although I didn't suspect my knee because it wasn't hurting. So I said, well, what can we do about this? And she said, well, ultimately you may well need to have a hip replacement. But before we go down that route, can I recommend you to Lucy? So I took her at her word and contacted you, and you kindly did an assessment on what I could and couldn't do movement wise, and what was hurting and what wasn't, and started me off with a nice gentle program of exercises that would start to build up, as I understood it, the muscles around the hip that would actually then support the arthritis and enable me to get cracking again. I was pretty desperate, I think you may remember.
Yeah, I do. And something that's perhaps interesting for people to know is that you and I have never actually met each other in person, that we've always had all of our appointments, haven't we, by
We have indeed.
different video technology. So yeah. But just to pull out a couple of things out of what you've just talked about. The first one was that sort of diagnosis of arthritis, because I know with a lot of people that word can conjure up various sort of feelings and projections. How did that make you feel, or were there any concerns that you had around that?
Well, I was actually quite frightened, to be honest with you, initially, because I just love being able to be active and to be fit. It's just part of who I am as a person, to be honest with you. And I don't do it because I desperately want to lose weight or desperately want to be able to run marathons or anything. I just need to feel that I can do things physically, whether it's running or walking the dogs or whatever, you know.
Doing your fabulous dog agility stuff.
Well, yes, yes, yes. Yes, exactly.
And when you mentioned the fear that you felt, what just explain a bit more what you mean by that. What were you afraid of, I guess?
Oh, well, I was afraid of not being able to do the things that I have always loved doing and being able to do, because I enjoy running, and I've got my dog agility. And, you know, prior to that, I mean, historically, I'd done modern pentathlon, which is a, you know, run, swim, ride, fence, shoot, everything, you know, and I was used to being able to do all of that. And now suddenly it was like, oh, maybe I'm not going to be able to do that. So that was really my fear. And even if I could just walk and run, I'd be happy. So
Yeah,
you know,
I think that's the reason I wanted to ask you a bit more about that is because I certainly see patients who've been given the diagnosis of arthritis, that they automatically think that they're going to deteriorate and inevitably end up in a position where they're not able to do all the things physically that they want to be able to do, and it's this inevitable downward spiral, which is absolutely not the case, which has been, you know, your experience and the experience of many others. The other aspect was that you mentioned about the total hip replacement, and I remember again that's sometimes can make people feel, again, there's that inevitability of needing to have that kind of level of surgery, which still may be the case, but can sometimes then result in people being afraid to actually be physically active, because there's
yeah.
this sort of unfortunate misconception that by being active and doing exercises, you're increasing the speed at which you're going to need to have the surgery. But actually, as you know, that's not the case. So yeah, thank you for sharing that, because I know that's
I do think that's a really important point, because I did feel like that. But what was wonderful was that actually very quickly you allayed those fears and said, no, there is a way forward. And actually, if you do these exercises steadily and gradually increase them and follow the regime, then you will be okay for, you know, much longer than you may have anticipated otherwise. So that's what I did.
Yeah, and you were incredibly diligent. So I want to sort of talk maybe a little bit more about that in a minute, how you get your motivation, that sort of thing. But before we get onto that, another thing that you've talked about that I want to really emphasize to people who are watching this is the fact that you started with a very low level. You know, the exercises that I gave you started at a very basic level, and sometimes that can be quite frustrating, especially if, like you're used to doing all this high level stuff. But it has to start at that low level and to build up all the different muscles and load the joint in different ways and build up slowly but surely. It's not something that happens immediately. You don't just
no
nip out for a run straight away. So yeah, it's that very gradual build up that's important.
Yeah, I think yeah, that was, you know, it is a little bit frustrating to start with, I found, but you know, like you rightly say, you know, I'm a bit of a let's get on with it and get, you know, but you have got to be a little bit patient. But honestly, it's so worthwhile, because you would not recognize what I can do now to what I could do when I first met, or didn't meet you.
So it sounds all really fabulous to those probably watching right now, but I know, as you do, that it wasn't a continuous positive, you know, you have gone through periods of time where you've had flare-ups along your recovery journey. So I'm interested to ask, how did you handle those inevitable flare-ups that occurred to get to where you are now?
I think, I mean, what I tend to do is, when I got to the point where actually I was type of pain free for a while, and then suddenly it would flare up, I was thinking, oh, for crying out loud, what's gone wrong now? That was my initial thought, but I thought, no. And then through talking to you and calming me down, say, no, this is actually what happens, and just keep going. I mean, yes, there have been occasions where I've taken painkillers, but very, very rarely, thankfully. And I've kept doing the exercises, and then, you know, you do come through that, and then, you know, and those periods of pain-free are getting longer and longer and longer. And I still have those flare-ups, as you know. But now I think, oh, it's a flare-up blast. Let's just keep going. And then sure enough, you come out of it at the other end.
And I think that's what's fabulous. You know, although in the first couple of flare-ups, I had to sort of guide you through the physiology of what was going on, explain, reassure, you know, that you get through it. What's great now is that I know that if you have a couple of days where you have pain, I know that you manage it. You know the things to do yourself to manage that flare up, which is really brilliant. And it doesn't stop you from doing the things that you love doing for too long, which is great. Any tips on motivation? Because you were you were throughout the treatment progress, throughout the treatment pathway, you were incredibly dedicated the whole way through. So any tips for our viewers on how to stay motivated?
I mean, I think because I was clearly making progress, it really, really helps. And if you make progress, even if you can only just see a small amount of progress, it encourages you to continue day after day. And I am actually quite a determined person, and I wasn't willing to accept that this was the end of the road for me. I've always been a little bit feisty, shall we say. And so I think that
goes a long way. It does.
Yes.
Yeah.
You know, this is my life. I am determined. I am going to keep fit and be active, and nothing's going to stop me. So, and I had, because I think we built a really good relationship very early on, and you carried me through that, you know, those type of difficult times like we've just talked about when it got painful. Actually, that has really helped me. And I always felt so much better after one of our sessions, because not only were you encouraging me with the exercise wise, but actually the way in which you dealt with me and sorted me out. I felt so much more positive coming out of that I felt, yes, I can do this. Come on, yes, I can do this. That carried me through. So
I recently did a blog, a written blog actually. I need to turn it into a video, but about all the different elements of motivation and how to create positive habits. So if anyone is watching this and wants to have a bit of a read of that, then get in touch. I can send it to you, or do have a look on the website. If you go to the website and you put on into the search tool at the top either the word motivation or habits, then there's lots of tips in there. But yeah, really, yeah, determination is the key, isn't it?
Just to add as well, though, I do think that, well, for me, and obviously I think other people are similar, is if you establish a time of the day where you're always going to do it. Now, for me, it was type of when I'd done what I would call my initial chores around the house, you know, and then I thought, right, I've done what I need to do, because I've always been one, let's get the things you don't want to do done first. And then, you know, and then, so it always was just before coffee time, mostly, you know, that I did that. And that I think really helps.
That is absolutely a fundamental part of building those habits, is to tag it onto something you already do, get it done early on in the day where you've got a bit of a supply of motivation. So yeah, absolutely. Really good tips. Thank you. So Olivia, I think we might wrap up quite soon, but just before we do, could you just tell our viewers what you're doing at the moment, or certainly now that lockdown has lifted, the fabulous activities you do, because I just think it's so inspiring. So
well, out for an hour and a half first thing in the morning, and then four of the 7 days I'm now training my dogs, and I do dog agility competitively. So I'm doing a lot of running around courses, and then when I get back, the dogs go out for another three-quarters of an hour, which is some more walking. And then in between while, I'm either doing competitions now, back again, or I'm running, and I'm running now 2 or 3 times a week, 5K. Brilliant. So and when I think I could barely walk. Yeah. Oh, I can only say thank you for giving me my body back, Lucy. It really has been, and just having my body back.
That's a pleasure. And just to reiterate that was achieved by you and all the hard work you put in. So well done. And just, I think that's a really positive note to end on, that you know, if you think about how you started, really not being able to walk very much at all, and now you're doing all that incredible activity, hopefully that gives people the hope that they can start to build up some of their own strength and activity levels. obviously under the guidance of a health professional. That's really important, to get a good diagnosis and to do it under the guidance of a health professional, so that you know that you're doing good, not harm. Is there anything else that you would like to add before we say goodbye to our viewers?
No, I mean, I think it's not giving up hope.
Yeah.
Because seriously, you know, people hear that word, and like me, it's like, oh, no, you know, it really can be managed, and with support and help, gradually building up. And now, I mean, you would just not recognize the activity levels, as you've heard, through that just steady build up.
Well,
Thank you.
Olivia, thank you so much for joining us today. I think everyone watching this will feel inspired by your story, and I'm really grateful for you joining us. So on behalf of all our viewers as well, thank you. And for those of you that are yet to subscribe to my channel, please do subscribe. We do lots of advice videos, and on the website octopusclinic.com there's loads of exercises on there that you can take a look at. And in the meantime, take care. Bye.